My name is Gaurav Aggarwal. I'm a director with Lasons India Pvt Limited, and I'm also the CEO of our brand, which is called Onelife. We are based out of Mumbai in India. Well, if you look at the global nutraceutical industry, it is estimated at about 260 odd billion dollars. Of that, India is just at about $2 billion. We are likely to grow to double at about 4 billion by 2020. But if you look at a global scale, we're still very, very small, although growing very fast at almost 20% per year. See, we're a pharmaceutical company. We're manufacturing vitamins for the last 38 years. And One Life is nothing but a nutritional brand to start with. So this is a direct vertical for us, and it adds value to our existing manufacturing capabilities. And therefore, we thought of One Life. And we are experienced in this industry with a very rich experience. We're supplying our products to over 90 countries globally, and we cater to human nutrition, animal nutrition, as well as cosmetics. So we understand this business very well. We know this business very well, and therefore we decided that since the business is doing well and the growth in India is good and the requirement is fairly large, we decided to go one step forward and come from B2B to B2C. Well, what we bring on the table is over 3 decades of pharma experience. So we have in-house quality control, we have quality assurance. We bring that entire infrastructure on the table. So we are not a fly-by brand which comes and goes. We are here, and like any other reputed pharma company, we bring an infrastructure and resources on the table. So we follow certain norms and standards. We go down to the traceability of all our products as well as raw materials. And that is what differentiates us. I can also tell you very proudly, if you look at our packaging, it is, I can tell you, by far should be one of the most informative to educate the customer for transparency label, which you will find on any other brand. If you look at the labeling laws in India prescribed by the authorities, they're pretty impressive. For example, the Indian FSSAI, in our case, requires the labels to have the name of the manufacturer as well as the marketing company. It has to have both the license numbers of these two different entities, if they are different. If they're one, it's okay. But if they're different, then it has to list that. There are various certain things mentioned by the FSSAI which are not there in global brands. If you look at a brand from any Western country, it may just say simply exclusively manufactured for XYZ, but you don't know where it is manufactured. And as a consumer, imagine you buy a product and you don't know where it is manufactured. It only says it's manufactured for a company. So the laws in India are very informative if they're followed properly as compared to the world. Globally, I think they're not as informative. They're not so transparent. They do not educate the customer or provide enough information to the customer, and a lot of it is hidden. We just, believe that everything that comes from the Western world may be extremely nice. I'm not saying it's not nice, but if you compare label to label, our Indian labels are far more informative for the consumer. For example, like I said, the manufactured part. On a label, when you see the Indian label, you will see the company that has manufactured the product, and you'll see the company that is marketing the product. Both the names are there available for the consumer. The consumer can at any given time Google both the companies and see their standing in the market. A typical American company would say manufactured exclusively for XYZ. But where is it manufactured? You won't even know where it is manufactured. Not even the country, forget who has manufactured. So you simply have to go by the trust of the company marketing whose name is mentioned on that label. So this is to give you a very simple and typical example of that labeling issue. We've started with 10 products initially. This is because we wanted to focus on the nutritional side. So we have products for heart, bones, joints, a multivitamin for men, women, fish oil, and so on and so forth. Moving forward, we have been given a mandate by the management to focus on a range specifically for the senior citizens and also diabetics. Our country, we have a massive population which are suffering from diabetes, and this is common in almost every other household, including my own. And therefore, we are going to be working, our researchers are already working on various formulations which will help the diabetics in our country. We're also working very, very aggressively towards children's healthcare. So certain things which our children are not getting in their daily diet or their food needs to be complemented and supplemented with products like ours. So we are going to focus a lot on the senior citizens and on the children. We're also working on the women's range and a whole gynec range for the women. So it is a mix. We have doctors, we have nutritionists, we have our own experts who work in house, and we work with we work a lot with the RDA guidelines also. What does the typical diet contain? What does the body need in India? Not abroad, but India. Every country has its own diets, every country has its own environments, and therefore, for example, India, yeah, we're highly deficient on vitamin D3. We're a country with so much of sun, and yet we're deficient on D3. That may not be with the case with a country that does not have sun throughout the year. So every country is different. What we do is we take our Indian population, we figure out what the food, the staple diets are, we see where the shortcomings are, and we try to make formulations which complement the food they take and add value by what they're not taking. So we work with, there's ayurveda involved, there's homeopathy involved, there's we look at allopathy, and so various factors, and then they're all combined and formulated by experts, and then we also look at the competition and we try to add value. So we are trying to make our products economically not very expensive, rather more customer friendly in terms of for your pocket, but also making sure you get the maximum nutrition required for the body. So moving forward, we are, like I said, we're working on a various product range, right? So One Life is about nutrition, wellness, and beauty. Beauty being the cosmetic side, which will come at a much later phase. Currently, we are trying to introduce 5 to 10 products in every quarter, if not sooner than that. And we aim to be at about 50 products in the next 3 to 4 months. And by the end of the first financial year, we aim to be or hope to be at about 100 SKUs. So these would be 100 products in the nutritional and wellness side. In addition to that, we are also going to diversify into retail, which will mean our own retail chains for our own products. And so this will be on a pan-India basis, offline sales also, not just online sales.